Castaneda, and I'll be doing my client assessment for nursing 3403 for Utrgv. I have identified my patient, I have washed my hands, and I'll be putting on my gloves. I will start by inspecting the chest. I will be observing for any abnormalities such as deformities, any lesions, masses. Now I will be observing the client's face. I'm looking for any nasal flarings that would indicate any respiratory distress, and any lip pursing, which would be often seen in asthma, emphysema, or congestive heart failure patients. I will now be observing the client's anterior thorax, and I'll be observing for the use of any accessory muscles, and then I will move over to the posterior, and I will be also assessing for any lesions, deformities, masses, or any indication of respiratory distress. I will now be palpating the anterior thorax, and I will be using the fingers to palpate for any tenderness, any masses, and any lesions. At this time, I will be assessing performances. I will be placing my hands on the client's chest while the client repeats 99 each time.
99, 99, 99, 99, 99, 99.
Now I will be palpating the anterior chest wall, and I will be placing my hands on the anterolateral wall with my thumbs along the costal margins pointing towards the xiphoid process. I will be observing the movement of my thumbs. My thumbs should move outward from the midline in a superficial fashion. You're going to take a deep breath and then let it out. Deep breath. Let it out. I will now be palpating the posterior thorax. I will be placing my hands on the client's back, and I will assess for any tenderness, warmth, pain, or any other sensations. I will now be assessing for firmitus. I will be placing my hands in several places of my client's back, and each time my client will be saying 99.
99, 99, 99, 99, 99, 99.
Next, I will be palpating the posterior chest expansion. I will be observing the distance my thumbs move apart. I will now be percussing the anterior thorax for tone beginning above the clavicle, followed by the intercostal spaces comparing the sides. Now I will be percussing the posterior thorax, and I will begin the percussing the posterior thorax for tone, and I will be starting at the top of the both shoulders, then the intercostal spaces comparing each side. Then I will percuss at the lateral aspect as the basis of the lungs comparing sides. Next, I will be assessing for diaphragmatic excursion. I will have the patient exhale forcefully, then hold his breath, and then beginning at the T9 to mid subclavicular line, I will percuss the intercostal spaces of the right posterior chest wall until the sound changes from renaissance to dullness. Forcefully, saca el aire. Hold it. Breathe. Exhale and hold your breath.
Wait.
Go ahead and breathe. Go ahead and breathe. Exhale forcefully. Take that deep, and then hold it. Okay. I will be auscultating beginning in the anterior thorax, and I will try to identify normal breath sounds as well as any abnormal sounds, including wheezing, rales, rhonchi, or stridor. I'm going to go ahead and listen to your lungs. So each time that you feel the diaphragm of my stethoscope, just go ahead and take a deep breath, okay? I will go ahead and clean my diaphragm with alcohol, and then I will warm it in the palm of my hand. Now I will be auscultating the posterior thorax, and I will have the client take deep breaths each time. I will now be assessing the client's neck vessels, and I will begin by inspecting the neck vessels by placing the client on his back, and I will be using the jugular vein, and I will be observing for any pulse or pressures. I am looking for distension in the jugular vein, and I will be assessing the client at 35 degrees, 45 degrees, 60 degrees, and 90 degrees. Go ahead and turn that way. I'm assessing for any jugular distension. Go ahead and turn the other way. Okay, go ahead and look straight. Go ahead and look that way. Straight. And the other way. Okay. Now I'm assessing at 60 degrees. Turn the other way. Okay. I'll be assessing the client's jugular vein at 90 degrees. Turn the other way. I will be auscultating the carotid artery, and I will have my client turn away from me while he holds his breath, and I will be placing the valve on the carotid artery while the client holds his breath. Hold your breath. Now I will be palpating the carotid artery, and I will be placing my fingers medial to the sternoclavicle mastoid muscle. Turn the other way. Now I will be inspecting the pericardium for any lesions, masses, or areas suggesting any tenderness. Client should be supine 30 degrees to 35 degrees with a pillow. I will use light to inspect for heart pulsations at the apical pulse. It may or it may not be visible. I will now be palpating the pericardium for any lesions, masses, or any tender areas. Next, I will be palpating the apical pulse. First, I will help the client roll to his side, to the left side, and I will be using the palmar surface of my hand, and I will palpate at the mitral area. Then after locating the pulse, I will palpate more accurately using my finger. I'm going to go ahead and turn you to the left side. Okay? Go ahead and turn. You recording? Now I will begin auscultating the heart by placing the diaphragm of the stethoscope at the apex, listening for heart rate and rhythm. And then I will auscultate to identify the heart sounds at S1 and S2. I will place the diaphragm on the 5 areas of auscultation: the aortic area, the pulmonic area, the Erb's point, tricuspid area, and mitral or apical area. I will also auscultate with the client at the left lateral position, placing the bell of the stethoscope at the apex of the heart, and then auscultate with the client sitting upright. Now I will be assessing the peripheral vascular. I will begin by inspecting the client's arms, observing for size and venous patterns, looking for any edema, noting also the coloration of the client's hands and arms. Next, I will palpate the client's hands, fingers, and arms, noting temperature. Next, I will perform the blanch testing to assess capillary refill. I will compress the nail bed until it blanches. Then I will release the pressure and I will wait and note the time that it takes for the color to return. Okay, now I'm going to check the client's pulses. I will begin on the wrist. I will be palpating the radial pulse on both wrists, noting the strength and elasticity.
Tienes otro.
Next, I will inspect the client's legs and I will observe the client's legs for skin, color, and distribution of hair, and looking for any lesions, ulcers, or edema. Next, I will palpate bilaterally to assess for temperature of legs and feet. Next, I will be palpating the femoral pulses. I will have the client bend the knee a little bit and I will press slowly but deeply. Then I will slowly release the pressure until I feel the femoral pulse. I will now palpate the popliteal pulses. I will have the client bend the knee and then I will detect the client's supine position and then I will go ahead and palpate the pulses. Next, I will palpate the dorsalis teres pulses, and I will assess both pulses simultaneously to compare each side. Next, I will palpate the posterior tibial pulses simultaneously to compare each side. At this time, I will inspect the client's legs for thrombophlebitis or varicositis. I will have the client stand at this point.